Talk radio to feed your brain. The DREX Radio Show. Weeknights at 7 on KGO 810.
All right. The seating situation in the studio is making me need a Xanax right now.
I'm sorry. We were talking about Janet Jackson, and I was being a diva about my chair, and then...
We're having musical chairs in the studio. You know, Ron Owens has his own chair. Chip Franklin has his. I have mine. Heather has hers.
I need the one that gets high, and none of them would go up.
Right?
We found it, though, right?
Okay,
Are you comfortable? I want you to be comfortable.
Well, I wish I could lean back a little further, the gangsta lean, but I'm okay.
I'll find you a chair that leans.
Let's get Dr. Leahy on the line. Dr. Robert Leahy is my guest, and he is the author of The Worry Cure. Good evening, sir. Thank you for joining us.
How are you, DREX? Thanks for having me on.
You bet. Thank you for joining us. And we're talking tonight a little bit about CBT, cognitive behavior therapy, and also, if you don't mind, anxiety disorders.
Right.
And I think that let's start with the breakdown, because I was talking about GAD and general anxiety disorder. That's one of them. And I have suffered from that in the past. What are the different types of anxiety disorders?
Well, you have simple fear, like fear of snakes or dogs. You have post-traumatic stress disorder, where a person's been exposed to a traumatic event, often a life-threatening event, and they have flashbacks and the sense that it's happening again, often nightmares. Obsessive-compulsive disorder, where the person feels that they have to repeat an action or neutralize something. You have panic disorder, where a person's afraid of having a panic attack, where they think if I have a panic attack, I might go crazy or die or collapse. We have social anxiety disorder, where a person's afraid of being evaluated negatively and afraid that people will see their anxiety and reject them. You have generalized anxiety disorder, which is really kind of the worry illness, where the person has hyperarousal. They're physically aroused and sweating and tense, but they also worry a lot about the future. And so in my book, The Worry Cure, I really focus on the worry part of it. That's a really key element. And, 38% of people say that they worry every day, so it's a pretty common problem to have worry. About 10% of the people have generalized anxiety at some point, which actually often leads to depression. You kind of worry yourself into being depressed.
Yes, do we find that people have this more these days as we live in urban areas and the internet and social media and everything's just catching up with you or breathing down your neck?
Well, it's good. It's a good question. They actually did some research looking at the level of anxiety of high school kids between the 1950s and 1997, looking across various research studies. And they found that the level of anxiety in 1997 for the average high school kid was higher than the average psychiatric patient in the 1950s. So there are a lot of factors that affect that, and I think things are probably getting worse. Kids growing up, and young people often having very unrealistic expectations, having fewer opportunities for work. There are a lot of kids who are kind of in between college and trying to figure out what to do with their lives. And you have people changing where they live. In the 1950s, people often grew up in the same neighborhood, lived in the same place for 15, 20 years, knew the same friends, close to their family. But today, people move every few years, so there's a lot more change and a lot more uncertainty. And at the same time, expectations are exceedingly high. So I live in New York City, and you're in L.A., so you can imagine the kind of expectations that people can get from, looking at fashion models and looking at people in the media and so forth. So, yeah, it's a lot of pressure, and it's very, very difficult for a lot of people. Something like 28% of the general population has a history of an anxiety disorder.
And I can relate, as I mentioned earlier in the show, right after we started. So when we come back with the doctor, Dr. Robert Leahy, as our guest, we'll talk about effective treatment. And if you've gone through this, you might have some questions or comments. We already have calls rolling in here, 808-0810. If you're listening anywhere else outside the Bay, around the world at KGO Radio, it's 415-808-0810. And we'll continue in just a minute right here. You know what? And I'll tell you what, There are so many things going on with this. We'll talk about the medications. By the way, you can join us on Twitter at Generation DREX, Generation DREX. And the tweets are rolling in here. Yes, what about the medications? What do I do? Okay, I'll ask about it. And also, we'll talk about CBT, cognitive behavior therapy, coming up as we continue on the DREX Radio Show on KGO 810.
10.
You're listening to the DREX Radio Show.
Why do I let myself worry?
Don't worry. We're talking about anxiety and worrying, as a matter of fact, but we have 7 steps to stop you from worrying. Yes, we need to put a stop to it. Dr. Robert Leahy is, it's Leahy, am I right?
Leahy is correct.
Leahy is correct. Okay, and he has a great blog on Psychology Today, and he writes for Huffington Post, and he founded the American Institute for Cognitive Therapy. So, Doctor, when we talk about The Worry Cure, the name of your book, you have 7 steps. Let's talk about some of the 7 steps to stop people from having anxiety.
All right. I think the first thing to ask yourself is my worry going to be productive or is it unproductive? For example, productive worry is thinking about something that could go wrong that I can do something about today. For example, I'm going to be going to Chicago next month. Productive worry would be, do I have a plane reservation? Do I have a hotel reservation? That's productive because there's a to-do list today. I can actually do something today to solve that problem. What's unproductive is something I can't do anything about today. So I'm going to be giving some lectures there in Chicago. It's unproductive for me to worry, will people like me? Will they ask me questions I can't answer? Will the plane crash, whatever? There's nothing I can do about that. So I think the first step to ask yourself, is this worry going to lead to any productive action today? If it's not, then it's unproductive worry. The second step, if it's unproductive worry, is to ask yourself, can I accept some uncertainty? Can I accept some unclarity about things? So, for example, it's uncertain if the plane's going to crash. It's uncertain if people won't like what I say. If I can accept that, then I can get on. A lot of people worry because they want to figure out for sure what's going to happen. But you actually know, because, DREX, we have a radio show, you know that every time you have a guest on, it's uncertain. You don't know what they're going to say. You're uncertain when you go to a restaurant. You don't know what that's going to be. You're uncertain when you get into traffic. We accept uncertainty every hour of the day, and accepting uncertainty in terms of worry is a key thing. I think related to this is the issue of when I have a worried thought, like something could go wrong in the future or whatever. People who have generalized anxiety have these worried thoughts throughout the day and the night. They wake up at 2 o'clock in the morning and they think, oh my God, what will work be like tomorrow? Will I ever find the love of my life? They worry at 10 o'clock in the morning. One of the things that we have people do is to set aside time during the day, like a 20-minute period, let's say at 4 o'clock in the afternoon, 20 minutes where you sit down with the worry. So if you have a worry at 10 o'clock at night or 10 o'clock in the morning, you put it aside. I'll get around to it at 4 o'clock in the afternoon. Some people say, well, I can't do that. Almost every patient I've ever had has been able to do that. And what you find at 4 o'clock in the afternoon during your worry time is that what you were worried about before, you're no longer worried about. Then you can ask yourself, is this going to be productive to keep worrying about it, to keep dwelling and spinning my wheels, or is this something I have to accept the uncertainty or accept that I don't control things and I won't know till I really know? I think the other thing that we have to think about is that you can focus on goals that you can accomplish rather than focus on problems that you can create in your mind that you can never really deal with until they happen. So you could worry about something that might happen a week from now or 2 weeks from now, or you could focus on goals that you can engage in right now, which may not even be relevant to your worry. Like you can go exercise, you can call a friend, you can do some things that are pleasurable.
Yeah.
The other thing is to look at, people who worry tend to think that if something is possible, then I need to worry about it. And you can think about almost anything is possible.
Sure.
So the question really is not, is it possible? The question is it probable? So is it possible the plane could crash? Yes, planes do crash. What is the probability? Well, it turns out, let's say, actually did some research a number of years ago. You can fly round trip from New York every day, 35,000 years until your number comes up. So I'm betting that the plane's not going to crash. I'm going to bet on the probabilities. But people who worry think, if it's possible, I need to worry about it. The other thing that happens when people worry is that they have a thought that comes to their head. I call these intrusive thoughts. These are unwanted thoughts. Oh, my God, the plane could crash, or people could not like me, whatever. And then they feel like they really have to pay attention to that thought. It's almost like you get hijacked by things going on in your mind. One of the techniques that I found very useful is to think about that intrusive thought as a telemarketing call that you don't take.
Exactly.
You get telemarketing calls, you get emails that are in your spam filter. You don't take them. You don't respond to them. And when you get used to sort of saying, oh, that's a telemarketing call, that's spam filter, I don't really have to pay attention to it, I can leave it aside, I can get around to it, to worry time. These are things that you can do right now. You can do these things today.
That is a great concept. You can just empty the wastebasket of your mind of all that spam.
Sure, it is. And what he said about the 4 o'clock, you're putting it in the 4 o'clock block. I
love that he said take 20 minutes at 4, because then it's 4:20 and you just smoke up and you won't worry about a thing.
Well, ladies and gentlemen, and if you didn't know what the doctor was doing, that is CBT. That's cognitive behavior therapy.
You, right?
Absolutely. Yeah. Yes, it is. And I knew that's where you were going when you were discussing it. Because, and this is back to the general anxiety disorder, which I have every once in a while suffer from. It's worrying about next, and you can't fix next. Right. You can't fix next in your life.
Right.
Yeah.
It's unpredictable next, So it is one of these things that, in my case, usually happens at night. So I do want to ask you about medication, because there are certain medications that work for people, and of course you don't want to abuse them, and I've been very careful with that. But I will tell you, when I need to calm down and stop the madness at night, I use Xanax.
Right, and and the reality of it, DREX, is that a lot of therapists, a lot of doctors say only what I do works. I feel that when a patient comes to me, I have an obligation to provide them with everything that is available that's going to be helpful. So I'm completely fine with people taking medication.
I know you are. That's why I'm asking you. Yes.
Or a Klonopin, whatever, to get some sleep. Fine. If you need a Zoloft or Prozac, which can also be helpful with generalizing anxiety and help reduce the depression, fine. That's no problem. It's like if you had hypertension, if you had high blood pressure, and the doctor says you should take a beta blocker. Well, that's great. You should also lose some weight, stop smoking, reduce your stress. Try to do as many different things to deal with your worry and your arousal that can be helpful. Don't take an all or nothing view, like it's only medication. I mean, pills are great, but pills don't teach you skills.
No, you're absolutely right. I think, and you tell me if you agree, Doctor, I think cognitive behavior therapy should be necessary for every single United States citizen who goes through school or college or whatever at some point in their life. I think it's a wonderful thing for everyone to learn.
Well, I don't know.
It would never be mandated. It would never be mandated. But if you could if everybody could just look at it and and step back from themselves.
Yeah, I think what like when you go to high school or college, you don't take courses on how to deal with unemployment or how to deal with boredom or how to deal with anxiety. But those are things that are going to be inevitable for a great number of people. I think that it might be very wise to prepare people and prevent anxiety, to give kids the skills to identify, I'm engaged in mind reading, I'm jumping to conclusions, I'm thinking about things as catastrophes, I'm taking things too personally, and here are 10 techniques that you can use. And, give them some of those skills. You can teach those skills in just a few hours for some people, and then you can just begin practicing them. And that actually can be very, very helpful in reducing the risk for anxiety. I mean, all of us get anxious. The question is, what do you do when you get anxious? Do you get more worried? Do you ruminate? Do you avoid things? Do you drink? Do you use drugs? Or do you have skills that can be useful? And I think the great empowering thing, DREX, about cognitive behavior therapy is that we actually empower the patient. We give the patient the tools to use to solve their problem in between sessions. If you see a patient for 45 minutes a week, how about the other, 7 days and 24 hours, whatever, that the patient has to deal with their problems? Give them the tools to solve their problems.
There's some fantastic things in there too. And everybody, well, not everybody, but at least CBT, more and more of the country is accepting that, especially when you talk about depression or substance abuse, whatever that may be. Instead of it's got to be the 12-step way or the highway. Not so much anymore. When we come back on the other side, I want to ask about that. And we have some calls here about OCD. We'll get into this in a second. We're talking about the Worry Cure. We're talking about anxiety, and Dr. Robert Leahy is the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. And we'll get to more of those steps coming up on the DREX Radio Show on KGO 810. Right now, it's time to, I hope you're not having an anxiety attack right now.
The voices in his head may not be real, but they have some really good ideas. The DREX Radio Show on KGO 810.
Is that really the lead-in, that rotator? The voice is inside his head. Is that really what I want to play when I have Dr. Leahy on the line?
Are we playing all your favorite hits, by the way, Dr. Leahy?
Yes, I feel honored.
Right. It's not the Xanax you need. It's the Prozac, DREX. Come on.
Oh, come on. The Beach Boys will do it to you every time.
Amen. All right. Yes, Dr. Robert Leahy is my guest, and we're talking about anxiety specifically, but we'll get to some other things. He's the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. And, one of the things that I wanted to talk about also is when we talk about anxiety disorders, I wanted to ask you about cognitive behavior therapy, back to the anxiety. And I wanted to walk down just for a second or two here, down the addiction road with substance abuse. And one of the things, thinking about cognitive behavior therapy was the ability to step outside yourself and whatever your addiction might be, whether that be alcohol or drugs or chocolate or whatever it is, if you stop yourself and look outside of yourself for about 20 minutes, that craving goes away.
It's interesting because, there are a lot of people who advocate 12-step programs and other kinds of interventions, and there is some evidence that like a 12-step program will work, but it really depends on how often you go to meetings, how much you participate. So simply saying that, I went to AA, that's going to work, it really requires a lot of commitment to change. I think there are a lot of factors that are involved. I think a lot of times to look at what are the emotions that the person's trying to escape from. Like my belief is that all of us are a little crazy and a little bit neurotic, and I think your listening audience will say, yeah, he's talking about me. We're talking about everybody. We're all a little bit crazy. And so people who often drink or use drugs have a fear of having loneliness or sense of emptiness or anxiety, and they believe that these feelings are going to last indefinitely and they're just going to overwhelm them. So one of the reasons why people drink is that drinking works, or use drugs because drugs work, but they work for like an hour.
Yeah.
That's right.
The question is, what you want is something that's going to work for a lifetime. And that's why having a healthy, balanced life, which means accepting having bad feelings, is an important part of life. That there's no way of getting out without being unhappy or being disappointed or being lonely. It's recognizing that it's temporary and that you can handle it and you can deal with it. And when you recognize that, when I was in graduate school, I took judo, and the first thing what we learned how to do is how to fall. And our judo coach told us, once you're no longer afraid of falling, then you can do judo.
Oh, that's
when you're
cool.
no longer afraid of being unhappy, then you can live a full life.
Amen.
Yeah, and I think the thing that you learn is...
We've got to wrap it up here, but that's good stuff.
The things you worry about sometimes say, that thing did happen, and you know what? It wasn't the end of the world.
And you can
So
move
just
on.
move through things.
Right, exactly. It's amazing how resilient we are when we really have to live in the real world. It's amazing how worried we are when we're living in an imaginary world.
There you go.
Dr. Robert Leahy is our guest, and he is the author of The Worry Cure. And it's 7 Steps to Stop Worry from Stopping You. We'll post it at KGORadio.com so you can get the link. And Dr. Robert Leahy, thank you very much for joining us this evening.
Thanks for having me on. It's been great talking to you guys.